That constant fear of pain, bloating, constipation, or sudden diarrhea can quietly control your life. If you're living with IBS, you're not alone. And more importantly, you're not helpless. Today, we'll walk through how IBS is treated, step by step, in a simple, realistic, and human way. Not promises of miracles, but practical tools that actually help real people feel better. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Understanding IBS treatment reality. The first thing to understand is this. IBS is different for everyone. What calms one person's gut may worsen another's. Some people have mild symptoms and need no medication at all. Others need a combination of lifestyle changes, diet changes, and medicines. The goal of treatment is not perfection. The goal is control, comfort, and a better quality of life. Lifestyle changes that really help. The goal of treatment is not perfection. The goal is control, comfort, and a better quality of life. Lifestyle changes that really help. Think of the gut as an emotional organ. Stress, routines, sleep, movement, they all talk to your intestines. Regular exercise. Even gentle movement matters. A daily walk, light yoga, or stretching helps the gut move rhythmically. Many people notice that on days they move their body, bloating and constipation feel less intense. Stress management. Stress doesn't live only in the mind. It lives in the gut. Deadlines, arguments, poor sleep, emotional overload, these can trigger cramps or urgency. Simple habits like deep breathing, mindfulness, or quiet time before bed can calm the nervous gut. Symptom and food diary. For 2 to 4 weeks, writing things down can be powerful. What you ate, when symptoms appeared, how stressed you felt, whether you exercised. Patterns slowly appear, and those patterns guide healing. Home remedies that may help. Some people benefit from probiotics, the good bacteria for the gut. They're not magic pills, and they don't work overnight. They're usually tried for about 12 weeks while watching symptoms closely. If bloating, gas, or discomfort improves, great. If not, they can be stopped. IBS treatment is about listening to your body's feedback. Diet changes for IBS. Food doesn't cause IBS, but it can trigger symptoms. Low FODMAP diet. Many people with IBS are sensitive to certain carbohydrates that are hard to digest. These can ferment in the gut, causing gas, bloating, pain, or diarrhea. Reducing these foods, under guidance, often brings relief. Fiber adjustment. For constipation-predominant IBS, soluble fiber helps, but adding fiber too fast can worsen bloating. Slow and steady changes work best. Dairy and gluten awareness. Some people tolerate dairy or gluten poorly, even without allergies. Reducing them may ease symptoms, but nutritional balance must be maintained. Water intake. Hydration keeps stool soft and the gut moving, often underestimated, but extremely important. Medications for IBS symptoms. Medication is chosen based on the dominant symptom, not the IBS label alone. Abdominal pain and cramps. Antispasmodic medicines relax the gut muscles. Pain may not disappear completely, but it often becomes more manageable. Constipation. Increasing soluble fiber is the first step. If needed, gentle laxatives may be used for short periods. Certain medications work directly on gut nerves and fluid movement, helping pain, bloating, and stool passage. Diarrhea. Anti-diarrheal medicines can slow bowel movements. The dose is individual. What works for one person may be too much or too little for another. Bloating and gas. Peppermint oil or peppermint tea can reduce gas and gut spasms. For some people, it becomes a simple daily comfort ritual. Antidepressants in IBS. Why they're used. This surprises many people. These medicines are not always used for depression here. Low-dose antidepressants can reduce how strongly the gut feels pain. They calm the gut-brain connection. They're often helpful when pain, anxiety, or sleep problems coexist with IBS. Psychological therapies. A powerful tool. IBS is not in your head, but the gut and brain are deeply connected. Therapies like cognitive behavioral therapy, hypnotherapy, and psychotherapy can significantly reduce symptoms in many people. They help retrain the nervous system that controls digestion. For some, this becomes the turning point in long-term symptom control. Long-term outlook with IBS. IBS is usually a long-term condition. Symptoms come and go. There may be long symptom-free phases or periods of flare-ups. The good news is this: most people find a combination that works for them. Over time, many notice their symptoms become milder, less frequent, and easier to manage. Some even reach a point where IBS fades into the background of life. Let me leave you with this: IBS does not define you. Your gut may be sensitive, but it is also adaptable. With patience, awareness, and the right support, life becomes bigger than your symptoms again. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.